Namaste, खुश रहो बेटियां. Today we are discussing about the topic of arthrography. Introduction is a radiological examination which is performed to demonstrate and access the joint and associated soft tissue structures for pathologic processes after the injection of contrast media into the joint capsule. Now discuss about the indications. Find abnormal growth, fluid filled cyst, loss of motion, loose body, tear in the soft tissue of the joint, that arthritis, cartilage, capsular or ligamentous injuries, trauma, persistent pain, dislocation. Contraindications: local sepsis, avascular necrosis of bones, reflex, sympathetic dystrophy, a group of symptoms including pain, tenderness, warmth, or coolness. Now we are discussing about contrast media. Two types of contrast media: radiopaque and radiolucent. Radiopaque contrast media is positive contrast media, which have ionic and non-ionic contrast media. Ionic contrast media is zero graphene and non-ionic contrast media is ion. Radiolucent contrast media is a negative contrast media which have air contrast media induction. First is directly into the joint space, second is indirectly into the blood stream and eventually absorbed into the joint. Equipments: fluoroscopic unit with a spot film device, radiographic cassette, contrast media, long and thin sharp needle, surgical gloves, lead apron, spirit. Patient preparation: any radiopaque artifacts are removed from the area of interest, for example, duplicate teeth, hairpin, earrings, etc. Second is ensure that no contraindication to the pharmacological agent used. Check pregnancy state. Procedure should be explained to the patient before undergoing the procedure. Advise the patient of any complications involved with the doing the procedure. Patient must sign an informed consent form before the procedure is done. The procedure is patient wears a hospital gown. After that, the ready the position of patient. The preliminary films takes without contrast. Next is skin around the joint is cleaned by antiseptic solution. Contrast is injected into the joint using long thin needle. Next, patient is asked to move the joint, which allows the spread of contrast throughout the joint. Next, spot film imaging. For double contrast study, air is infused into joint and this provides better visualization. Filming: preliminary film, anterior posterior AP, lateral, additional film according to the joint to be accessed like that for knee, scalene and tunnel view. After there, rest the joint that was injected for at least 12 hours after the procedure. Next is ice packs or over-the-counter pain relief medication is recommended to decrease pain and swelling. Symptoms of pain, red skin or fever, or more days following the procedure should be reported to your physician. Risk: a risk of infection, possibility of vessel or nerve injury, contrast allergy reaction, chance of cancer from excessive exposure to radiation. Thank you. The session is over.